Dr. Priyanka Mehta, gynecologist and laparoscopic surgeon from Apollo Women's Hospital, Chennai. Semen analysis. Whenever a couple comes for either they are trying to conceive or they've been planning a pregnancy, the first thing that ideally we write and give it to them is the semen analysis. Now this sometimes puts off the male partner because they are like, no, you first check my wife because I think everything is okay with me, I take a proper diet and there should not be any problem with my sperms. But that is not the reason why we ask for a semen analysis at the first go. For females or for the female partner, there are a number of tests that we have to do when we are either trying to conceive or part of a pre-pregnancy planning. So if they are having difficulty in conceiving, for women there are a couple of tests and many of these tests are invasive. So like you talk about HSG or so many other tests, you have to actually, it could be painful or sometimes it will take more time. But the first test which ideally should be done is the semen analysis, because for better understanding, the sperms usually are produced and they take at least 60 to maybe even 70 days for them to mature. And if there is a problem with the semen analysis, we can actually give a basic treatment and then we usually repeat the test after 4 to 6 weeks, sometimes even 8 weeks depending on the problem, so that we're able to get a clear picture. Especially in these times of high stress, lot of lifestyle diseases, it is so important that the male partners come forward and do the semen analysis as the first test, because that will save a lot of time for them as a couple when they do the treatment. Now, what do we look for in the semen analysis? So there are a number of parameters that we actually look for in a semen analysis, but what you should do as a person who is trying to conceive and you have come for a semen test is you choose your laboratory carefully. So semen analysis is a very delicate, it's a very, very important test, and you cannot just do it randomly at any laboratory, because most of the general laboratories which do the blood tests or the urine tests and all, they are not having personnel who are trained to handle the semen sample carefully and also to read the fine details and interpret the fine details in a correct manner. So it is important that when you do the semen analysis, number one is you do it at either a hospital attached andrology lab where they do regularly procedures like IUI and IVF, so that they are able to understand how to handle the sample correctly, how to give you advice of how to collect the sample. They will have a proper place for you to collect the sample and you'll be able to get a very reliable report, because a lot of our treatment is going to depend on your report. Another thing is that sometimes in many of the laboratories there is no proper collection center. So if you just go to any random laboratory, you will probably just be given a bottle and you will just be sent to a very unhygienic washroom and asked to give the sample. And then probably you may not be able to give a proper sample, and then the entire report depends on that. Now, what do we look for in the semen analysis? So the first thing is we look for the amount. So usually the sample should be say 1.5 to 2.5 ml. We look at the color, so it should not be very yellowish or greenish in color. Usually it is grayish or a milky white in color. Also, we look at the count of the sperms. So count of the sperms also is important, because the entire sperm testing will depend on the count of the sperm. We also look at the motility, the forward motility, and there is a specific criteria with which we compare, because we want to see how many sperms are actually actively moving forward and how many sperms are not moving at all and how many are moving very slowly. Another important factor that we look at is morphology. That means the entire shape of the sperm. So the sperm will have a head, sperm has a body, sperm has a tail. That is how each sperm is designed to be. But many laboratories don't look at this parameter carefully, don't give a very strict report based on which if you are looking at a semen report of 80% normal morphology or 60% normal morphology, then I think that report is totally wrong. Because when we look at a properly done semen report in a certified accredited laboratory where they follow the WHO strict criteria, the maximum amount of morphology normal sperms is not more than, it is 4 to 14% is the criteria. So even if we get 4% or 5% normal sperms as per the strict WHO criteria, we are actually happy. So you may get a report where your percentage of normal sperm could be just 1% or 2%. So don't worry about it. You have to go back to your doctor and show them the report. So another important thing that we look for is the presence of fructose, because otherwise we can detect if there is any kind of an obstruction somewhere. So you have to understand that the semen analysis is not just a test that we have to just do and get over with. And if there is a problem with the report, because many laboratories, when they analyze all of this, the pH, the amount of sperm, the count of the sperm, the motility, the morphology and the other factors, they will also write about any kind of an infection. So the WBC count also, if it is high, means there could be infection. There could be RBC, again showing that there could be some kind of an infection. So you have to see the entire report in totality. And if there is a problem, sometimes they write the diagnosis also. So don't go by whatever diagnosis is written there, because you have to ultimately take the report to your treating physician, to your doctor, to your gynecologist, your andrologist, whoever has asked you for the report, and then show them the report and discuss with them. Because we never go by one semen report. We always, if there is a problem, we actually go back, we give you some treatment, we do further tests, and then we usually repeat the report either after 4 weeks or 6 weeks. So at least 2 or 3 reports are needed before we kind of go by that diagnosis or label you as whatever diagnosis is there. Especially in conditions where the report comes as either an azoospermia or no sperm seen or very few sperm scenes, it is important that you go back to your doctor, discuss the report and get the proper advice, rather than totally shunning the doctor and just telling the female partner to go for the test. So please remember that semen test is a very, very important test, and that has to be done as the first test when we do the evaluation for infertility. So don't shy away with it. If you think that collecting the sample in the laboratory is difficult for you, it is not possible, discuss it with your doctor. And sometimes you can even collect the sample at home and then bring it within 30 minutes. So there are ways possible by which the semen analysis can be done. And if there are problems, reach out to your treating doctor and get it sorted.